WA. Thank you.
Thank you, Mr Milligan. The question is the Assembly do now adjourn. Ms Chang.
Thank you, Madam Speaker. I take this opportunity to put on the record my congratulations and my thanks to the Canberra Sexual Health Centre, which celebrates 40 years of operation today. The Sexual Health Centre began in 1979, before HIV, and a time when the term was STDs, not STIs. And, Madam Speaker, it began in a corner of the Canberra Hospital's emergency department, led by Dr Gordon White. Eventually it got its own space, and from there has gone from strength to strength to today, where it is under the leadership of Dr Sarah Martin. I was very pleased to be able to join Minister Stephen Smith at the celebration lunch today on site with current and former staff, including Dr Gordon White, who just recently was awarded an Order of Australia Medal for his service to medicine, particularly sexual health. I have personal experience with the centre, as I've spoken about before, and I think it's very important, Madam Speaker, to note just how dedicated these staff are, Madam Speaker. A number of them have careers not just in sexual health, but at the centre alone of more than 20 years. And I want to underline my thanks for all that they have done and all that they do, the treatment, the advice, the care and the compassion, and their collective efforts to remove stigma around sexual and reproductive health. And on that, Madam Speaker, it's certainly important to note that when the Sexual Health Centre began, it actually took them several months to fulfil some major staffing appointments because there was a fear among medical professionals that working in sexual health would ruin their careers. I hope and I think I can speak on behalf of many, if not all present today, that that's not the case and that it is a fulfilling and meaningful career, and one in which you can tell genuine pride is taken. And, Madam Speaker, there's a lot to be proud about. Also in attendance were the leaders of the other important parts of our suite of sexual health services in the ACT. Sexual Health and Family Planning ACT, or SHFPACT, Hepatitis ACT, and of course the AIDS Action Council. As AIDS Action Council Executive Director Philippa Moss said today, these organisations have a long, strong and enduring relationship with the Canberra Sexual Health Centre, where they all have a history of not only complementing each other, but also a history of working together in ensuring that the ACT and its residents are sexually healthy. We're very lucky to have such services and such leadership in this space for such a long time, Madam Speaker. But as I've iterated and emphasised in a range of forums, including in this chamber, it doesn't mean we can be complacent. We know that the number of people presenting to the centre is trending up, the number of STI diagnoses is trending up. We've still got plenty of work to do in the bloodborne viruses space, and there's some pretty daunting stuff happening with gonorrhea and syphilis. There's more work to do, and we do need to keep talking about this and taking as many comprehensive actions as we can. But today, Madam Speaker, we can pause and reflect and also be loud and proud about an extraordinary 40 years of the Canberra Sexual